Well, hello and welcome to this English lesson where I'm going to talk a little bit about pain and injuries. I'm going to talk about the things that don't feel right with your body after you do something like go for a run and maybe you run too long or maybe you fall down. These are the kinds of things that you will probably talk about if you go to the doctor. So this is a really good lesson if you want to learn how to explain what's wrong with you when you're in the doctor's office or when talking to someone at a doctor's office like a nurse. So I'll talk about things like scrapes and bruises and all of those kinds of things. Let's get started. When you go to the doctor, when you go to see a doctor because something is wrong with you, please notice the phrases that I'm using. We go to the doctor when something is wrong with us, okay? Maybe you have a headache, maybe something else is wrong with you. Usually one of the first things the doctor will ask is, where does it hurt? So if you've gone to the doctor because of an injury is something like when you fall and break your arm or when you hit your head in a car accident, we would say you have an injury. The doctor will most often say, where does it hurt? He might say something or she might say something like, what can I do for you today? Or what seems to be the problem? Those are other common questions as well. But generally, if you go in because you have pain, the doctor is going to say, where does it hurt? And then you will point to the part of your body that hurts. It's a very common question. I want to go over three words, though. I want to go over the word sore, the word hurt, and the word pain, okay? Because each of these is used in a couple of ways. When you are sore, it means that you have pain somewhere, okay? So you could answer the doctor and say, I have a sore elbow. So this is your elbow. You could say, I have a sore elbow. You could also say, my elbow is sore. If the doctor says, where does it hurt? You could say, I have a sore knee, or you could say, my knee is sore, okay? So there's two ways to form phrases with the word sore. Where does it hurt? My finger is sore, or I have a sore finger. When you talk about hurt, you can use this a number of ways, actually three ways. You could say things like, I hurt my knee. You could say my knee is hurt. Or, there's really only two ways. I messed up a little bit there. You would definitely say things like, I hurt my knee. I was out running and I hurt my knee. Or my knee hurts. So two ways to use the word hurt as well. Actually, there is three, because you could say my knee is hurting. My arm is hurting. That's a little more rare, but you could definitely say that as well. So I hurt I'm pointing here. This is your elbow. This isn't your knee. I hurt my knee. My knee is hurt, or my knee is hurting. Definitely another way to describe pain that you are having. And then we'll talk about the word pain itself. Pain is when there's a part of your body that just doesn't feel right. It feels wrong. It hurts. It's sore. You're in pain. Hopefully, if I use those words, you understand what I mean. If I hit my head really hard, I'll have some pain. In my last video, I slapped my face pretending there was a mosquito there, but I had to do it 7 times because I wasn't happy with it. And then I had a lot of pain on my face from slapping my face. That wasn't a good idea, but it was funny. Anyways, the word pain as well. You could say this. I have back pain. You could say, I have a pain in my back. Okay, so you have two ways, again, of describing where you have pain. So to go back, you could say, I have a sore back. You could say, my back is sore. You could say, I hurt my back. You could say, my back hurts. Notice I'm talking about the back now. And you could say, I have a pain in my back, or there is pain in my back. I have back pain, sorry. I have back pain, or I have pain in my back. So let's talk about some words that we say when we hurt ourselves. We often say things like, ouch. So ouch is something that you exclaim when you hurt yourself. If you were to accidentally, bump your head, you would say, ouch. You might also say, ow. So if let me see, I don't want to hurt myself here. So I'm not, I always like to give visual examples. If I was to punch myself in the head, I would say, ow, that hurt. If I was to punch myself in the head, I could say, ouch, that hurt. don't punch yourself in the head. It's not a very wise thing to do. Anyways, there's two words that you can use to express pain. You could say ow, or you can say ouch. Those two both work equally well. So here are a few things that you can do that will cause pain, okay? I sometimes stub my toe. When you stub your toe, let's pretend my hand is my foot. It's when you hit your foot against something hard. Maybe you hit it against a fence. Maybe you hit it against a rock. Maybe you stub your toe going up a stairs. Maybe the steps aren't the size you're used to, and you hit. So if you hit your toe against something, we say that you stubbed your toe. Sometimes when you stub your toe, you can break your toe. So a long time ago, I stubbed my toe so hard outside that I actually broke my toe, and I had to go to the doctor because I had a broken toe. I don't want to be too descriptive, but if this was my foot, my little toe looked like this. It was not straight anymore. So when you stub your toe, it means you hit your foot against something and your toe really, really hurts. So stub your toe. When you are walking or running or hiking, you might twist your ankle. So when you twist your ankle, you can see in the picture here, it's when your foot turns in a way that it's not meant to turn, okay? Maybe you step on a rock and your foot goes like this and you twist your ankle. Maybe you're just running really fast on a flat surface and then you go onto an uneven surface and you twist your ankle. When you twist your ankle, it's not very fun. I twisted my ankle once when I was really young playing baseball. I was sliding into second base and I twisted my ankle, and then I was on crutches for a while. So when you twist your ankle, it means you hurt. So that's the part between your leg and your foot, right? You guys know your body parts. Should I do a lesson on body parts? I should have done that before this lesson, maybe. Oh well, I think you know what your ankle is, but you can twist your ankle. When you hurt your back, we often use the phrase to throw out your back. Maybe you're lifting something really heavy. When you lift something really heavy, you sometimes can throw out your back. When you throw out your back, it means you suddenly have pain in your back. I see Brent saying, I kicked a cement pool while playing with my children and I broke my toe. It's not fun when you break your toe. That is painful. It's just a little toe, but it's very painful. So you can have pain in your back. You can have a sore back, but generally people will say, so where does it hurt? And you would respond by saying, oh, I threw out my back. I was lifting something really heavy yesterday and I threw out my back. So notice I went to the past tense there, but when you throw out your back, it means you have back pain, maybe because you turned too fast while holding something heavy, or maybe you were lifting something heavy. Just give me 1 sec here. I'm going to pull up my slides. I don't have them on the screen over here. Where are they? Just takes me a minute to see where I am. Oh, we're doing good. Sometimes you'll have a kink in your neck. So when you have a kink in your neck, maybe you're staring at your computer all day and your head is in the same position and you start to get some pain in your neck because you've held your head the same way all day. We would call that a kink in your neck. And then sometimes you do things like this to try to get the kink out of your neck. It's not fun to have a kink in your neck. I sometimes get a kink in my neck when I'm driving the tractor because I have to look behind me while I'm driving. When you do field work on a farm, you're always looking behind you, and then you get a kink in your neck. You start to have a bit of a sore neck because you're looking behind you so much. Sometimes you might get eye strain. So eye strain is when your eyes are sore. Usually this happens to me when I stare at my computer screen all day. Right now, because I'm teaching from home, I am on my computer all day and I get a little bit of eye strain. I try to wear my reading glasses. I got a new pair. How do they look? I try to wear my reading glasses as much as possible because that stops me from getting eye strain. But eye strain is when it's almost like having a little bit of a headache because your eyes are sore. usually from staring at a screen or from reading all day. Let me see here. You might also get an earache. So you might be going to the doctor because your ear just hurts inside. You have a really bad earache. And if the doctor said, "Where does it hurt?" or "What can I help you with today?" you could say, "Oh, doc." I don't say doc. You could say doc though. You could say, "Oh, doctor." See, I just call my doctor by his first name, but you could say, "Oh, I have an earache." So if you have a sore ear, if you have pain in your ear, if your ear hurts, you would say, "I have an earache." Headache is probably the most common kind of pain that people have. You end up, you work all day and you get a headache. Sometimes when you look at a computer screen all day, you get eye strain, but you also get a headache. You wouldn't necessarily go to the doctor for a headache. You would probably just take what are called painkillers. You would take Advil or Tylenol or ibuprofen or aspirin or something like that. Or you might just have a nap, okay? I don't have a slide here for toothache, but we also mentioned toothache when one of your teeth hurts. When your teeth hurt, you wouldn't go to the doctor. You would book an appointment at the dentist. You would go to the dentist and the dentist would figure out what's wrong with you. By the way, in Canada, when you go to the doctor's office, we call the doctor a doctor. When you go to the dentist's office, you call the dentist a doctor as well. Okay, so a dentist in Canada is a type of doctor. A really bad headache is called a migraine. I had migraine headaches for a little bit when I was in university. There was about a month or two where I had headaches that were so bad I could hardly see, and you would call that a migraine. So a migraine is a severe headache. A really, really bad headache is called a migraine. I think I had migraines because I was only 17 or 18 years old, and I think I was still growing. When you're still growing, you can have pain in various parts of your body as you grow. I think that's why I had migraines. Let me see here. Sometimes you bite your tongue. Sometimes when you're eating food, you'll bite your tongue. You wouldn't necessarily go to the doctor for this, but this is something you could do something you might do that hurts and causes pain. So you might be sitting and eating with people and all of a sudden you might go, "Ow," or you might go, "Ouch," and someone will say, "What's wrong?" And you'll say, "Oh, I bit my tongue," or "Oh, I bit my tongue." It's not a nice feeling. I don't bite my tongue very often, but I think everyone at some point in their life bites their tongue here and there by accident. When you do something by accident, it means you didn't mean to do it. You might have a nosebleed or a bloody nose. So this is another thing. It's not exactly pain. It's more of a mild injury, but you might have hit your nose somewhere and your nose starts to bleed. So you would get some tissues or Kleenex, we call them in Canada, to stop your nose from bleeding. It's actually common for some people in Canada and in other countries where we heat our houses in the winter. The air becomes really dry in our houses, and it can sometimes cause you to have a nosebleed sometimes. My daughter and myself, sometimes we will have a nosebleed in the winter because your skin and the inside of your nose, it gets really dry in the winter when you heat your houses. It's kind of a funny thing. All of my friends from Russia who live in the northern part of Russia where they have a good winter will understand what I'm saying. When you heat your house, the air gets dry. Sometimes you have a nosebleed, or we also call it a bloody nose. Sometimes you get in a fight, or sometimes you accidentally get hit by something and your eye will turn black, and we call this a black eye. You'll see this in the movies a lot. Someone will get punched in the movies, and then the next day they'll have a black eye. So a black eye looks exactly like that. I actually got a black eye once. The dentist pulled a tooth from the top back of my mouth. I had a tooth pulled, and a day or two later, I had a black eye because of the tooth. That's kind of weird. The dentist didn't punch me. There was no punching there. That wasn't what happened. But I think because of the tooth being pulled, it caused me to have a bit of a black eye. But normally you get a black eye when something hits you, or if you got in a fight. You shouldn't fight. You might get hit and get a black eye. Let's see here. So these are some general things which would be more referred to as sickness or illness. You might have a sore throat. So one of the symptoms of COVID is that people get a sore throat. When you have a sore throat, you talk more like this. It's hard to talk. It's hard to talk when you have a sore throat. I sometimes get a sore throat if I talk too much during the week. I'll get a bit of a sore throat. You might, sorry, let me look at my slides here. Nope, that's right. So another injury that you can have is something called a concussion. A concussion is very common with athletes who play games that are rough. So if you play soccer or football or rugby or hockey, if you play a sport where people physically hit each other, you are more prone to injuries. When you're prone to something, it means it's more likely to happen. One of the injuries that people who play those sports get is something called a concussion. It's when you hit your head so hard that your brain moves, I think, a little bit inside. I'm not a doctor, but here's the picture. And then it's just not a very good thing. Boxers, so boxing is a type of fighting, also get concussions. So it's an injury to the brain that's caused by hitting your head really hard or getting hit in the head really hard. So not a good injury to have a concussion. You might have joint pain. So this picture makes it look like joint pain is on the outside, but joint pain is actually on the inside of your body. A joint is any part of your body that bends. So your knuckles are a joint. Your wrist is a joint. Your elbow is a joint. Your shoulder is a joint. So the parts of your body where the bones connect together, we call your joints. So you have hip joints, knee joints, ankle joints, shoulder joints. Sometimes you have joint pain. So you might go to the doctor and the doctor will say, so where does it hurt? And you could say, my shoulder hurts. I have joint pain. I have some joint pain in my shoulder. Or my knuckle hurts. Sorry, I don't know why I'm laughing because it's such a small joint. My knuckle hurts. I have joint pain in my knuckles. Okay. So joint pain, again, the picture makes it look like it's on the outside, but joint pain is actually on the inside of your body at one of the locations, where your body bends, where it can flex. Shortness of breath. So this is another symptom of COVID, by the way. Shortness of breath means normally I breathe in and out very easily. When you have shortness of breath, if you go up a stairs, if you climb a flight of stairs, at the top, you might have to stop because you're just breathing really shallow breaths and you're having trouble breathing. So when you have shortness of breath, it's not a good sign, okay? So normally you can breathe freely, but sometimes you have what's called shortness of breath and it makes it difficult to breathe. Your heart, usually you don't have heart pain unless you have a heart attack, but you might have heart palpitations. That's when you can feel your heart beating in your chest and it might be beating irregularly. Or you might have a racing heart where your heart rate is really high. And those might be reasons that you're at the doctor as well. The doctor might say, so what can I help you with today? And you could say, oh, I've been having, an irregular heartbeat or heart palpitations, like where you can feel your heart beating really strongly. Or you might say, my heart has been racing for the last couple of days, or hopefully it hasn't been a couple of days. That's a long time. But these are things that would be wrong with your heart. Another normal thing to have is a fever, By the way, this is another symptom of COVID. So if you have a fever, it means your body temperature is higher than normal, okay? So if your body temperature is 39 or 40 degrees Celsius, you have a fever. I don't know what it is in Fahrenheit. I apologize to those of you that use Fahrenheit. But a fever is not pleasant. You feel hot. You might feel cold when you have a fever. Even though your body is higher, even though your body temperature is higher than normal, you might actually feel cold. It's kind of a strange thing. A stomach ache is when your stomach hurts. Sometimes when you eat food, you have a stomach ache because the food is bad. Sometimes you get a virus or a bacteria that causes your stomach to have pain, and you have what's called a stomach ache. You can see the word ache used again here. So when you have a stomach ache, your stomach feels funny. It might cause you to throw up. That's when the food in your stomach comes back out of your mouth. Not pleasant. A stomach ache might also cause you to have what's called diarrhea, where you're going to go and sit on the toilet. And I'm not going to describe that part. But a stomach ache is a fairly normal thing to have. You might go to the doctor. The doctor will say, so where does it hurt? And you might say, oh, I just have a really bad stomach ache. Another thing people experience sometimes is dizziness. So dizziness is when, normally it's easy to stand and to walk. When you're dizzy, it's almost like you start to fall over sometimes. Like you're kind of like, when you walk, you're like kind of going like this, wobbling a bit, because it feels like the world is spinning around you. So when you're dizzy, it's something in your brain and it feels like the world is spinning a little bit. So sometimes you have what's called a pulled muscle. So sometimes when you go running, sometimes when you lift something heavy, sometimes when you play a sport that you haven't played for a long time, you will have your muscle hurt. So your muscles, like this is my bicep, this is my tricep. The muscles are what make your arm move. Basically a pulled muscle is when you do something and then your muscles hurt for a few days afterwards. It's a fairly minor injury, a pulled muscle, but sometimes like I pulled a muscle last summer when I was working on the farm, and then I pulled a leg muscle, and then I just couldn't walk for about 4 or 5 days. Sorry, that's not true. I could walk. I couldn't go for a walk for exercise for 4 or 5 days. Hopefully you understood the difference. But a pulled muscle is not a nice feeling. You might also get what's called a Charlie horse or a muscle spasm. This is very, very brief, but very, very painful, okay? So a Charlie horse or muscle spasm is sudden pain in your muscle for about 1 or 2 minutes, and then it goes away. Sometimes you get a Charlie horse, again, when you do something that you don't normally do. Maybe you decide you're going to play football with your kids, and you haven't played football for a couple years. You might get a sudden Charlie horse in one of your leg muscles because you haven't done it for a while. Let me see here. Okay, so sometimes you break a bone or you have a fracture. We have 2 names for it. Again, when I was younger, I broke my wrist. I actually broke, I guess you could say my arm, but I broke the bone right behind the wrist here. I keep saying I broke my wrist, but the wrist is really a joint. I actually broke one of the bones in my arm. So I had a fracture. I had a broken bone. I had to get an x-ray and then they put a cast on. We'll talk about that later. Sometimes you can dislocate your shoulder. So your shoulder can actually pop out of its socket and then they have to put it back in again. I have never had a dislocated shoulder, but at school, one of my coworkers was playing football with the students and he fell on the ground and dislocated his shoulder. So his arm was actually hanging down here. And then he went to the hospital and then they popped it back in. I don't like talking about it. It looked really, really painful and it looked very strange. He had dislocated his shoulder. A dislocated shoulder isn't as bad as it looks. Usually they just pop it back in and they'll probably make you have your arm in a sling for a few days. But yeah, that did not look good. I didn't want to have a lot of blood in this lesson, so I found the smallest cut possible for this picture. Sometimes you're using a knife in the kitchen and you might cut yourself, and there can be more serious cuts, but a cut is when something sharp breaks your skin and you start to bleed. So you might have a cut. So again, you might be at the doctor saying, hey, I was working in the kitchen and I cut my finger and it's a really deep cut. When you have a really deep cut, the doctor might put stitches in. The doctor might get a needle and thread, just like you're sewing clothes, and they might put stitches in to your cut. I think Shawn Mendes has a song called Stitches. Yeah, I'm not sure if it's the same thing though. You might be playing outside or running outside and fall down, and then when your skin slides along the pavement on the road or on the gravel on your driveway, you might get a scrape. Kids often get scrapes when they're playing in the playground. So they might be running in the playground and they might fall down a lot, and then they might scrape their elbows or scrape their knees. It's very common for children to have scrapes. And then we also have what's called a bruise. So a bruise happens when, if something hit you really hard, then a day later or later that same day, you might have a bruise. A bruise is like a brown or black spot where I think it's from, you probably were bleeding under your skin. And then after a while, that just turns a brown color. And then a bruise will slowly disappear. After my heart surgery, for some reason, my left arm had bruises. The whole arm was bruised, and it took about 2 months for that to go away. I think because, I'm not sure what they needed to do. I'm not a heart surgeon, so I don't know. But a bruise looks like that. If you have a simple cut, you might just put a bandage on it. We have a box of bandages in our house. Most people do. If our kids have a small cut, they might put a bandage on the cut. So the cut that you see here, that's a cut where you might just put a bandage on it. We also call it a Band-Aid. Bandage and Band-Aid are the same thing. But definitely when you have a cut, especially if it won't stop bleeding, you will often put a bandage or a Band-Aid on it. When you pull a muscle or when you hurt yourself playing a sport, you might just put an ice pack on it, okay? Often when athletes twist their ankle, or maybe they hurt their knee a little bit, they might sit on the side of the court or playing field and just put an ice pack on it. So the ice pack is cool and it makes the injury feel a little bit better. It also stops swelling. Swelling is when things get bigger. So if you were playing volleyball and you hurt your elbow and you would say, oh, I have a sore elbow, I hurt my elbow, you might put an ice pack on it. You would stop playing volleyball and put an ice pack on it because you don't want it to swell up. So you would put an ice pack on it. By the way, this lesson is not a lesson where you get medical advice. It's just where you learn the words you need to learn to talk about these things in English. So don't quote me on any of my things. If you twist your ankle, you might end up on crutches. When I twisted my ankle as a kid, I was on crutches for a little bit. Crutches are what you see right there. I think they're béquilles en français. I think so. Sometimes I don't know all the words. They're in my head somewhere. But you might end up on crutches. This person has what's called an air cast. So there are various things you might do with a twisted ankle. You might simply wrap it. You might put a cast on it. Usually there's no cast, but you might have what's called an air cast, which is a cast that you can take off and put back on again. Madi says, I have first aid in my car. It's always good to have a first aid kit somewhere. We have a small first aid kit here in our house, for sure. Annette says, yes, béquille. Yes, thanks, Annette. It's one of those words, that you don't use very often. So like there's when you learn a language, there's words you use a lot, and then there's words you use like once every 5 years. So sometimes it's hard to remember. Going back to having a broken bone or a fracture, when you go to the hospital, it would go like this. The doctor would say, "So, what can I help you with? Where does it hurt?" And you would say, I think I broke my arm. I have a lot of pain in my arm." And the doctor would say, "Well, we're going to send you for an x-ray." And then they would send you either to a different building or another part of the hospital. You would get an x-ray, and then they would say, "Yep, it looks like you need a cast." So one of the cool things about casts now is that you can get different color casts. I'm not sure if you can in your country, but in Canada, you can choose what color cast you want. When I was a kid and I got a cast, it was white. When my daughter got a cast about 5 or 6 years ago, I think she chose pink or purple. Yeah, it was pink, I think. So she could choose what color she wanted. I thought that was pretty cool. Let's see here. After you injure yourself, you will often have what's called physiotherapy. Physiotherapy is where someone helps you do exercises so that your body works properly again. So if you broke your arm or you dislocated your shoulder, you might actually go for physiotherapy for a couple of weeks. And then they will help you learn, how to lift small weights and to use elastic bands to strengthen or to return your body to normal. The person who does physiotherapy is called a physiotherapist. So the man you see in this picture is a physiotherapist, and the woman is at physiotherapy. The short form that we use is just physio. So we'll say something like, "Oh, so you were in a car accident and you hurt your neck and you hurt your arm and your leg. Did you go for physio afterwards?" And the person will say, "Yeah, I was in physio for about 6 weeks." So physiotherapy is where you go. It's after you've gone to the doctor, after they've done everything to make you better, but you still need to kind of fix your body to be ready for real life. You need to make sure your joints work properly. You need to rebuild your muscles. After my heart surgery, I was in physiotherapy for 8 weeks. And so I went and they helped me get back into tip-top shape. So that's what physiotherapy is.